Hi, I'm Jen, and this content is sponsored by Sanofi. I'm a real patient, and I've been compensated by Sanofi to share my personal story living with chronic GVHD. Everything I share is my personal experience, and individual results may vary. Be sure to speak with your doctor. So I was 36 at the time. I ended up getting sick. I thought I had the flu or mono or something. I just couldn't shake it. It just wasn't going away. They finally did some blood tests on me, and it turned out I had acute myeloid leukemia. And they realized that I needed to do the bone marrow transplant, that chemo wasn't going to be enough to keep it away. Rob and I had been dating for about 9 months when I was initially diagnosed with leukemia. I was like, listen, you don't have to stay. You didn't sign up for this.
I didn't even have to think about it. I love Jen. I knew I needed to be there for her.
He has just been the support system throughout the entire process. He drove me to the hospital when I was initially diagnosed. He stayed overnight in the hospital with me day after day after day after day. And I think it just solidified that we were meant to be together.
And I said, Jen, let's be married before you come back in for your bone marrow transplant.
So I would try on the dresses for the nurses, and they were like, this one's good, this one's good, we love this one. And they helped us, helped me figure out what dress to wear. The following September, I received the bone marrow transplant. I was in a hospital room in isolation for weeks and weeks and weeks. That was like the most sick that I felt throughout the whole process. Then, a year and a half later, I had to undergo a mini transplant. It's called a donor lymphocyte infusion. But with that second transplant, that's when the doctors really started using the term chronic graft-versus-host disease, which I eventually developed. That's when the seriousness of the situation really kind of set in. At the time, we used a variety of different medications, treatments, because the chronic GVHD hits so many different body systems.
The eyes, your lips, your lungs, your skin, your muscles.
And I felt like I had little control over how I could manage that. After 2 failed systemic treatments, my doctor and I discussed REZUROCK. It was exciting, and it offered a little glimmer of hope. Our family, we just really appreciate time that we get to spend together. I think that's been a lesson to all of us, is just to be grateful for all these little things that you do have. REZUROCK is an effective treatment for me. The most common side effects of REZUROCK are infections, tiredness or weakness, nausea, diarrhea, shortness of breath, cough, swelling, bleeding, stomach pain, muscle or bone pain, headache, and high blood pressure.
Balancing life with someone going through chronic GVHD is something that you don't think about. You just do what you have to do.
I can't imagine doing this by myself. I don't think I would be here if I was alone. When we were in the hospital, we got to see how other people reacted to adversity and challenges. That was motivational and inspiring, and it's like, okay, I want to be that person. Here we go. I don't want to be like the person that is going to give up. It is the hardest thing my family has had to experience, and it's not something you ever expect to happen to you. I think my biggest inspiration are my children. I want to be there for them. I want to see them graduate from high school, which they just did. So those girls really are like the driving factor in my life.
Use. REZUROCK, belumosudil, is a prescription medicine used to treat adults and children 12 years of age and older with chronic graft-versus-host disease, chronic GVHD, after you have received at least 2 prior treatments, systemic therapy, and they did not work. It is not known if REZUROCK is safe and effective in children less than 12 years old. Important safety information. Before taking REZUROCK, tell your healthcare provider about all of your medical conditions, including if you have kidney or liver problems, are pregnant or plan to become pregnant. REZUROCK can harm your unborn baby. If you are able to become pregnant, your healthcare provider will do a pregnancy test before starting treatment with REZUROCK. Tell your healthcare provider if you become pregnant or think you may be pregnant during treatment with REZUROCK. Females who can become pregnant should use effective birth control during treatment with REZUROCK and for 1 week after the last dose. Males with female partners who can become pregnant should use effective birth control during treatment with REZUROCK and for 1 week after the last dose. Are breastfeeding or plan to breastfeed? It is not known if REZUROCK passes into breast milk. Do not breastfeed during treatment with REZUROCK and for 1 week after the last dose. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. REZUROCK may affect the way other medicines work, and other medicines may affect the way REZUROCK works. Know the medicines you take. Keep a list of them to show your healthcare provider and pharmacist when you get a new medicine. How should I take REZUROCK? Take REZUROCK exactly as your healthcare provider tells you to take it. Do not change your dose or stop taking REZUROCK without first talking to your healthcare provider. Take REZUROCK 1 time a day with a meal. Take REZUROCK at about the same time each day. Swallow REZUROCK tablets whole with a glass of water. Do not cut, crush, or chew REZUROCK tablets. Your healthcare provider will do blood tests to check your liver at least 1 time a month during treatment with REZUROCK. If you miss a dose of REZUROCK, take it as soon as you remember on the same day. Take your next dose of REZUROCK at your regular time on the next day. Do not take extra doses of REZUROCK to make up for a missed dose. If you take too much REZUROCK, call your healthcare provider or go to the nearest hospital emergency room right away. What are the possible side effects of REZUROCK? The most common side effects of REZUROCK include infections, tiredness or weakness, nausea, diarrhea, shortness of breath, cough, swelling, bleeding, stomach, abdominal pain, muscle or bone pain, headache, high blood pressure. Your healthcare provider may change your dose of REZUROCK, temporarily stop, or permanently stop treatment with REZUROCK if you have certain side effects. REZUROCK may affect fertility in males and females. Talk to your healthcare provider if this is a concern for you. These are not all the possible side effects of REZUROCK. Call your doctor for medical advice about side effects. Please see full prescribing information at the adjacent link or at REZUROCK.com. You are encouraged to report side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. You may also contact Cadman Pharmaceuticals, LLC, a Sanofi company, at 1-800-633-1610 to report side effects.